Hello all, and welcome to Coffee with Marci. Did you know that anti-aging products account for close to $9.8 billion of the skincare market? I know we all want to find that miracle in a jar to turn back time. Not sure that exists, but I do have some exciting news. Doctors now feel there are some promising new products and treatments available and others on the horizon. As a part of our ongoing May Smart Beauty series, we're here on location at the SLSS Ageless Center in Tenafly, New Jersey, with medical director and dermatologist Dr. Margarita Lolis, who is already using some of these new innovative treatments and products. Hello, thank you so much for coming on the show.
Thank you for having me.
This is awesome.
Very excited.
So tell us, SLSS Ageless, what is that exactly?
So SLSS is a dermatology office. We offer general dermatology, cosmetics, but the whole idea behind opening up another satellite office, which is called SLSS Ageless, is to kind of look at aging from externally as well as internally. So that's the whole premise of this office. And so we look at aging holistically. So of course we can outwardly make you look better, give you some tweaks, but what's going on inside? You could be 50 years old numerically, but biologically you could be 80 years old. And that's very, very important. So that's why here we look at prevention in terms of aging, bioidentical hormones, nutrition, detoxification, sleep hygiene, as well as your, state-of-the-art cosmetic treatments with fillers, Botox, lasers, and all that fun stuff.
So how do you determine that?
So every patient comes in for a 1-hour consultation. And we have very extensive questionnaires. I go over a large, extensive personal history. I do a general examination, and I kind of try and hone in on what exactly is bothering each patient, right? Then there's things we can do. We can send patients for blood tests. We can, prescribe some hormones. We can prescribe some nutraceuticals. There's so much that goes into the aging process, which is pretty phenomenal. So there's a lot of ways we can help you age gracefully, internally and externally.
So let's talk about wellness centers and what exactly that means and why they're trending right now.
So, I think a wellness center is kind of an ambiguous term. So, it could be anything from beauty, aesthetics, like esthetician services. It could be, a naturopathic doctor, chiropractics, acupuncture. So I think that these centers are trending, again, because we're advancing as a race, and we want to live longer and also live a better life, a better quality of life. Who wants to live until they're 80-year-old, but with diabetes, dementia, and multiple medical problems? And I don't think a lot of people do.
Yeah, and things you do help that?
Yes. Yes. Wow. So again, like I said, we practice evidence-based medicine, but hormones actually have a huge impact on how we age. And so we look at aging through a different kind of microscope.
Now, is that bioidenticals?
We're talking about bioidentical hormones in terms of estrogen and progesterone and testosterone.
And that's if you have perimenopause and menopause.
That's right. That's
when that's happening.
Perimenopausal, menopausal females. And the bioidenticals are great because they're, they're not even, they don't need to be FDA approved because they're bioidentical. In the past, there were synthetic hormones. And that's what all the bad press was related with the synthetic hormones. But now these are bioidentical. So there's really no harm. There's only good that most of the time comes out of taking them.
And how do you determine what type of bioidenticals? Are they all the same?
So they're not all the same. A lot of it is symptom-based. Dosages are different. Some patients need progesterone. Some patients need estriol or estrogen. And there's also different ways to compound it, meaning, different formulations, basically, to put it easily.
And you determine that here?
Yes.
After the testing?
After the testing.
All right, so I need that. Of course, I'm only 25, but I'm going. So is there any risk with bioidenticals?
So with any type of hormone, it's very important to look at family history.
Okay.
So if someone has a personal or strong family history of any type of cancer, including ovarian cancer, uterine cancer, breast cancer, cervical cancer, we have to be very careful, as well as clotting problems. So those would be kind of like the two categories where I'd be very hesitant.
Okay. You'd be hesitant to put them on the bioidenticals.
Correct.
And what would you look for as far as if somebody wasn't responding well to bioidenticals?
So if someone's not responding well, you know, we always track it by serum levels or blood work, but also symptoms. So I might have to go up on the dosing, down on the dosing, combine it with something else until we optimize that perfect treatment plan.
And how often do you test? Like once you put someone on the bioidenticals, I mean, do you come in every month? How does that work?
I mean, for my patients, I like to follow them very closely and kind of, you know, hold their hands. My philosophy is that it's not just a doctor's visit, it's a program that you're going to be on for the rest of your life.
Rest of your life. Okay.
Okay. So just like if you want to lose weight or you want a healthy lifestyle, you go to the gym, you know, and maintain that healthy lifestyle, not just for like 2 months.
Right.
So I like to check patients back in a month and periodically after that, and I like to be available to my patients all the time and hold their hands through this aging process.
Well, it's hard. It's hard when you're hitting perimenopause or hitting menopause. And I don't think people realize that perimenopause, it lasts about 10 years,
yes,
right?
It starts very early, actually.
Yeah. And the average age is, what, 50? When it starts?
Yes.
For me, it started at 40.
Yeah.
So it certainly does.
Exactly.
It starts younger.
And, you know, you're younger at that age, you have little kids, you have a career. Some women, even if you don't, there's so much that can, you know, really affect you. So it's always important, I think, to optimize.
Right.
And we're not even, if not just hormones, sleep has a huge part, exercise. You know, there's so many factors that play that we can tweak to make you feel better.
What are the signs? How do you know that that's even happening?
Okay, so, you know, I'm sure we've all heard about the typical hot flashes, sleep disturbances, lack of sleep at night, waking up, waking. Usually as our hormones change, we make less muscle mass and we put on more fat. Okay, and our body actually changes from like a female figure to more of like an android or male type figure where you store fat centrally.
Oh my God.
You know, obviously this doesn't happen to everyone, but these are things that could possibly happen.
I gotta just take a second on that one.
So these are all the changes that happen during perimenopause, and then obviously as you go into menopause, you stop menstruating.
Yes.
So you have lack of a period. Our bones break down. Osteoporosis kicks in. You know, our muscles break down, so we make less muscle mass.
Right.
Therefore, you can gain weight.
Right.
You know, and then you're more at risk of other cancers as your hormones decline.
So that's what the bioidenticals help with.
Yes.
And then they help with all of those symptoms to correct them.
Yes.
Because it creates a balance in your body.
Correct.
Right.
And progesterone is actually really good for sleeping at night.
Oh, so let's talk about sleeping.
Yes, sleeping.
So that's really important, and I know a lot of us ladies have issues with that. So give us some tips. What do we do?
So how many hours do you sleep at night?
I probably wake up like every 3 hours.
Yeah. So most people, the average American would probably get 6 to 8 hours of sleep. That's actually not enough. You need 8 to 10 hours of sleep a night.
I mean, does anybody really get that? Just have to say.
But that's just to highlight how important sleep is and how we're not even realizing that we need more sleep. We're not even close. So, you know, as you can imagine, sleep can affect your mood, your productivity, memory, everything.
Yes.
So, and then the other thing is detoxification. So as we're exposed to different toxins in what we eat, what we, exposed to environmentally, they all get stored in our liver.
Yes.
Okay. And so it's very important to detoxify, which basically means it helps you rid all the toxins and aids your liver to eradicate all those toxins within your body. And so it makes you healthier. You can also lose weight on it, which is great.
Yeah.
But overall, it makes you feel better and, rid your body of all those toxins. It makes you healthier overall.
And how do you detoxify?
So it's basically nutritional supplements.
Okay. And how long do you have to do it?
There's different courses. There's like a 10-day course. There's a 30-day course.
Oh.
So I basically, try and judge it based on the patient and how long they would probably be able to endure it. And then maybe, we'll start with a 10-day course. Maybe 3-4 months later, we'll try a 30-day course, something along those lines.
Do you get to eat during that time?
Yeah, you eat.
Okay.
Yeah.
A lot of people I've heard say your body naturally does that.
It does.
It does.
I mean, biologically, your liver is there to help detoxify what's in the blood.
Right.
And however, this kind of aids the process because we're exposed a lot environmentally into what we eat. Right. There's a lot of xenoestrogens, and it accumulates. So it kind of just like helps aid that along better and quicker.
Right, because environmentally, everything has changed.
100%.
And what we're ingesting has changed
a lot.
Right. So I know skin is one of the things that can be affected. So why don't you tell us about that?
Okay. So there's intrinsic aging, the skin process, as well as extrinsic aging. So extrinsic would be the sunlight, smoking. But as we get older, our collagen breakdown is higher, as well as we stop making collagen. So everything is kind of broken down. And that's why we have fine lines, wrinkles, loss of skin tone, elasticity, and we have more, gravity kind of takes its toll. However, estrogen is actually very protective to the skin.
Okay.
So it helps you build collagen. So you can imagine as you go through menopause, your estrogen declines, there goes your skin.
Yes.
So
it just declines.
It just declines from there on.
Everything declines.
So I like to simplify it and say the basis of most of these beauty devices or laser devices is to build collagen. Okay, you want to build collagen.
Yes.
You want to help your skin tone and texture, so pores, different colors in the skin, the firmness of the skin, as well as the fine lines and wrinkles. So there's a lot of laser devices out there that basically stimulate your own body to do that.
And you have ones that you use.
We have a lot of lasers, and yes, I have my personal favorites.
Yes.
And then obviously we have the Botox, which doesn't, it just temporarily relaxes your muscles so you don't form, the fine lines and wrinkles on the forehead or wherever else you want to do it, and the fillers fill in lines.
Okay. So
and volumize.
And volumize. So when would you want to do that?
There's mixed opinion. The trend now is for younger and younger girls to actually start Botox, and they call it preventative Botox.
Yes.
So, I am a fan of that personally because I've seen a lot of patients who come to me for Botox.
Yes.
And I'm like, oh, I wish they came like a little bit earlier because they already have those etched in lines.
Right.
And so we can put Botox in, relax the muscle, and smooth out those lines, but they're still going to be there. And you might need a filler to fill them in.
Yes.
So why not start a little bit earlier, get ahead of the curve, so that you never reach the point of no return.
That's interesting. I was wondering about that because I've heard about the preventatives. So you're a fan of that.
Yes, and Botox I'm a fan of, and then obviously the laser treatments.
The laser treatments.
In terms of the fillers and all that, I like things to look very natural. Yes. So I wouldn't do that preventatively, but definitely lasers.
And that's long term.
Long term, you maintain it, but it's long term. You're making your own body build collagen.
Right. So speaking of that, let's talk about my skin, and I'm excited because I get to have a treatment. So what do you suggest for me?
Well, you look great.
Thank you.
First of all, beautiful.
Thank you.
So, we can do a little skin firming laser. It's actually radio frequency.
Okay.
And so what that does is it heats your skin up to a certain temperature where we know your body is going to start making collagen,
Okay.
put simply.
Yes.
And so it's about like a 10-minute treatment. We can kind of treat this lower area.
Okay.
That's where things start to show up.
Yes.
And you'll be red for maybe about like an hour later, and that's it. There's really no downtime.
Oh.
And we recommend it 5 times every like 2 to 4 weeks.
Okay.
And you should see a nice improvement.
So 5 treatments, and you should do one every 2 to 4 weeks.
Yes.
And how long does it last?
So, like I said, you're simulating your own collagen, so it
Yes.
should last. With that said, I always tell my patients, follow up every 6 months to a year.
Okay, every 6 months to a year.
Yeah, depending on the
just
patient.
Once,
Yeah.
I am here with Dr. Margarita Lolis, and I am about to have my treatment. So can you tell us what the treatment is?
So today we're going to do something called radio frequency treatment on Marci using the accent device. And technically this is not a laser, but for all intents and purposes you can think of it as just a device. And what it does is it feels like a warm massage on the skin, so it's actually very comforting and comfortable. And it's going to heat up the skin to a certain temperature where we know it's therapeutic and effective to tighten. And that's about it. You're going to enjoy it.
Fantastic. I look forward to it. So what's first?
Okay, so first I'm going to apply a little mineral oil on the skin, and this is what gives the conduction.
Okay. So is there any instructions that you give to your clients before they come in?
For this particular device, it's very safe, and I would say not really. Always my advice is, wear sunscreen. But
Maybe not come in with makeup on.
That's right.
Or
No
clothing.
makeup.
You don't want to get
Clothing
messed
you
up.
want to mess up, correct?
Yeah.
If you can't do this if you have a pacemaker or defibrillator.
So what do we have next?
So we're doing the accent device, and it's very pleasant. You're going to feel like you're getting a nice little warm massage on the face. We're also going to do the neck because this can show a lot of people's age because a lot of people neglect the neck, so don't do that. And so basically you're going to feel very comfortable, warm.
Okay.
You're going to feel like you're
All right.
covered. Okay. So just circular motions, and you have to tell me if you feel like it's getting too warm.
Okay.
And then we move on to a different area.
And this helps with the collagen.
This helps with the collagen.
That's right. Now I have really thin skin. I know, everyone has different types of skin. Texture.
Exactly.
Yeah. So
this will help make it thicker,
Okay.
for sure. You need to be on a good skincare regimen.
yes.
So usually what we say is sunscreen, moisturizer. You want a retinol product, depending on how sensitive your skin is. Growth factors, an antioxidant, and a brightener. So it sounds like a lot,
Yes.
but we can customize, depending on the patient. But that's a general rule of thumb.
And you have skin products.
Yes, we carry a lot of skin products, Skin Medica. We carry Sente, Restorcy. We really take our skin products very seriously, so we're very eclectic in that sense.
You put together a skin regimen
Yes.
for each client?
Yes,
Oh,
exactly,
Okay.
and based on the problem. How does this feel?
It's not too warm.
But it's comfortable.
Yeah, should I feel it more though?
If it's not too warm, I want to put it higher.
Yeah, a little
Okay.
higher. So how about for me? What type of skin regimen do you think that I should have? Or just you, is it just what you said?
Okay, so do you have sensitive skin?
I do, I have sensitive skin, yes. Not real sensitive, but
No.
it is sensitive.
When you wear products on your face, any of them bother you? Have you ever
No.
had an allergic reaction?
No.
Nothing like that.
No.
Okay, well that's good. So I would obviously start off with a broad spectrum sunscreen. I would say 30 or above.
Okay.
And by broad spectrum, I mean sunscreen that covers UVA and UVB rays, because sunscreens don't cover both.
Oh, I
both
see.
of them. So that's extremely important.
Uh-huh.
So for you, I would definitely do that. You know, a moisturizer.
Yes.
What, do you have a specific moisturizer you like?
I don't. You know what? I'm not married to any one product, to be honest with you. It's just what if I'm in a department store, something looks good, or if I get a treatment and they recommend something.
So I tell patients, because you know there's a lot of moisturizers out there and some are fancy, some aren't. If you have sensitive skin, I would stick to something like basic, like Cetaphil, Aveeno, CeraVe. And if you don't, I would just stick to moisturizer that you like, that makes you feel like you're not dry. And then I think for you, you do have a little bit of sun damage and sunspots, so I would definitely use a brightener.
Okay.
The one I like is Lytera.
Okay.
So it brightens, it doesn't act like a bleaching cream, which is great. And it actually is very moisturizing as well. And then I would probably use the Sente Dermal Repair Cream. And that's a cream you're going to put on twice a day, and it has a lot of, how do I put this, ingredients that build collagen, like hyaluronic acids in it, some peptides, growth factors. And then my favorite product front of the eye is from Restaurant. And I've had patients come back wanting more and more because they love this product.
What does it help with?
Tighten the under eyes, the dark circles, and the
puffiness?
The elasticity, the creepiness of the under eyes.
Oh, the crepiness.
Yes.
Now I've always had
crepiness over there?
well, not crepiness necessarily, but puffiness.
Puffiness.
I grew up in Houston, so my allergies were really bad. So yeah, they're really bad there, but not as bad here. But it is something that I've always fought.
Yeah, that can go hand in hand with allergies. For puffy eyes, I recommend a eye cream that has caffeine in it, because it constricts.
There you go.
Yeah, it constricts. There you go, coffee. Exactly. So it constricts the blood vessels. It helps with dark circles, puffiness, all of that.
That's fantastic. I was looking into products that had caffeine in them because there's so many healing products.
That's right.
Yes.
That's right.
So it's not just good to drink and wake up your mind and brain.
Caffeine is great for
A multitude of things, yeah.
How's the heat?
It feels fine.
Comfortable, right?
Yeah. So you can change the heat.
I can
Everyone's
change the
different.
settings. Yes, everyone's different. Different parts of the body obviously are different. We also use this on the abdomen, on the thighs for skin tightening, cellulite, under the eyes, the neck. Really, we use this anywhere. But again, the settings are different. And each time I like to go up on the settings, so increase the power.
And this helps with cellulite?
Yes. Yes, we do this for cellulite as well.
I mean, I think most women battle cellulite.
Yeah.
And I know that I've also heard that you have more fat cells in different parts of your body than others. And sometimes where you have that, it's very difficult to manage and change.
Yes, they're stubborn.
Yes. You
They're
can't
stubborn.
shrink those cells there necessarily. So that's when something like this really comes in handy.
This can help, and then there's, other treatments. Liposuction, obviously, it removes the cells. There's cool sculpting.
Because there's also, I like to be clear that these things really aren't for losing weight. They're for those troubled areas.
And that's what a lot of people don't understand, especially with liposuction. The best lipo candidate is actually someone who's at their best weight and physically fit, but that just has that stubborn pocket of fat that won't go away.
Yeah.
Kybella is another product we use for under the chin, for that double chin. It works great. And again, sometimes that's genetic. You can work at and be as thin as you can, but you just have it.
Exactly.
So thank God for technology and Kybella to get rid of that, right?
So these are all non-invasive ways
Yes.
that you can help yourself fighting the aging process. Yeah. So do I look 10 years younger yet?
Getting there. So it looks like we're just about done. As you can see, you're just a little bit red. And that's it. There's no downtime and you're gonna look amazing.
I love it.
And I'll see you soon.
Thank you, Dr. Lolis, for coming on the show. And my
Thank
treatment.
you for coming.
Thank you for my
You
treatment.
look beautiful.
Thank you. It was so awesome.
Hope you like it.
Yes, it didn't hurt at all, and I can't wait to see the results. And now I feel like I'm red carpet ready for the NJ Hall of Fame.
Nice.
Yes.
Right on time by Sunday.
Yes. I'm very excited. So guys, tune in on Sunday, May 6th. I will be live at the New Jersey Hall of Fame, and I can't wait to share with you all of the honorees. Thank you again for tuning in, and we'll see you soon. Remember, you can download our show on the NJ On Air app, which is available on Roku, Android, and iOS devices.